Namaste. This is Dr Vijay Anand Reddy, Director, Apollo Cancer Institute, a senior cancer specialist, oncologist, and head of the department of Apollo Cancer Institute, Hyderabad. Today we will be talking about the lung cancer, the frequently asked questions by the general public. We would be addressing most of those questions. What is lung cancer? Lung cancer, like any other cancer arising from the lungs. We have two lungs, right and left lung, for every human body. Lung, as you all know, would help us in taking the breath in and out, by which it gives you oxygen and exhales carbon dioxide. When a tumor develops in any part of the right lung or left lung, we call it as lung cancer. What are the signs of lung cancer? Lung cancer, as it starts in any part of the lung, that might give you different kinds of symptoms. In an early stage, you would start developing cough, occasionally to start with, and over a period of time, it becomes more and more cough, which could be dry cough, and later on, you start developing breathlessness, and that is nothing but shortness of breath. So when the disease becomes bigger and bigger, and it occupies a good amount of lung, then you'll start developing breathlessness. Some patients might even have, while coughing, some kind of a bleeding coming out while coughing. Some patients in advanced stages can even have hoarseness of voice. That's when the tumor involves the nerves in the center of the chest. Then you start developing hoarseness of voice because of the damage to the recurrent laryngeal nerve. Are there any hidden signs of lung cancer? Basically, normally most of the people would ignore some kind of a dry cough on and off, which is known to happen for so many other reasons. Simple cold, simple lung infection, or any kind of dryness or allergy would result in dry cough. So if the cough continues to happen for more than 2 to 3 weeks after a standard of care like cough syrups or antibiotics, you should always get more investigated in the form of simple X-ray. And if you find any small shadow in an X-ray, then you have to get a CT scan done. So these signs and symptoms of lung cancer can be hidden, may be ignored as a routine cough. So please do not ignore them if this cough continues to bother you for more than 2 to 3 weeks. Can lung cancer come in children also? Lung cancer usually happens at an adult age group after the age of 30-40, more so after the age of 50. In children, lung cancers are very, very rare. How can we prevent lung cancer? Lung cancer is definitely preventable. There are several causes that can cause lung cancer. Most important of all is tobacco, either in the form of smoke or in the form of chewing. Tobacco is very harmful to the body, and when you inhale, that damages every part of your windpipe system and both the right and left lungs. Over a period of time of repeated tobacco smoking or chewing, it causes chemical chemical trauma to the lungs and windpipe, and then it starts developing into a cancer. The more you smoke, it depends on the number of cigarettes as well. If you increase the number of cigarettes smoked per day, the chances of having cancer in the lung or elsewhere in the body is to the tune of 80% in your lifetime. Chewing tobacco also causes lung cancer. Apart from that, the diet, the lifestyles, and the atmospheric pollution also lead to lung cancer. So if you keep this in mind, never ever take tobacco either in the smoking form or in chewing form. And also, most importantly, this causes a secondary damage to the people around you. Your friends, your spouse, and children can also be affected when somebody smokes. So you have to tell and keep yourself away from people who are smoking. What are the treatment options for lung cancer? Treatment options mainly depend on the stage of lung cancer. Stage 1 lung cancer can be easily dealt with and it can be highly curable. It can be treated by a simple surgical resection of that segment of the lung or by doing high dose of radiation in 1 or 2 days, which is called stereotactic radiation therapy. So these days for elderly people without operation, we can do stereotactic radiotherapy which destroys that stage in early stage of lung cancer. Once it becomes stage 2, after surgery, you may have to go for adjuvant treatment in the form of chemotherapy. Very rarely, you may also require radiation if the tumor is spreading to the lymph nodes, which we call it as stage 3. When the tumor is spreading from the primary lung into the mediastinal lymph nodes, then you may have to give radiation and chemotherapy. It's only in stage 1 and stage 2 we will be able to do surgery. So beyond stage 2, patient would require a combined modality of treatment, which could be surgery, radiation therapy and chemotherapy. Of late, we have a new drug which has come into, which are called targeted therapy and immunotherapy. These are used in advanced stage of lung cancer beyond surgical stage. That means beyond stage 1 and stage 2. Any patient who has got stage 3 or stage 4 diseases, we target these tumors with targeted therapy plus or minus immunotherapy. Targeted therapy and immunotherapy are very good methods of treating these lung cancers, wherein the side effects are very, very minimal because the targeted therapy comes in a tablet form, and those tablets are going to attack only the tumor cells and very less side effects because it does not affect the normal cells. Similarly, you have immunotherapy which boosts up your immunity to fight the cancer cells, and it has really made a big dent in lung cancer by combining chemotherapy with immunotherapy, or in some patients only immunotherapy, has extended the life of stage 4 lung cancer from few months to several years. How painful is lung cancer surgery? These days, lung cancer in stage 1 and stage 2 are easily resectable, especially with robotic surgery or laparoscopic surgery, video assisted laparoscopic surgery. It is very simple and very patients would recover in a day or 2 and they'll move out of the hospital on day 3. So very simple surgery, and we don't remove the entire lung. We only remove that segment. It's called segmentectomy, or that particular lobe wherein the rest of the lung would still remain normal and patient would be able to breathe normally and live a normal life. Can lung cancer be cured? Yes, of course. In stage 1 and stage 2, we will be able to completely cure the disease. In stage 1, no further treatment would be required. In stage 2, you may require chemotherapy or radiation to prevent recurrence. In stage 3 and stage 4, we are able to control the disease for several months to several years. Lung cancer these days is no more to be worried about. In stage 1 and stage 2, we are able to cure them completely. In stage 3 and stage 4, we are able to control the disease for several months to several years. The only caution that I would suggest is do not ignore the symptoms like dry cough or breathlessness. You should see a doctor if the cough or breathlessness bothers you for more than 2 to 3 weeks.